So I would like to start the session with thanking the organizing team for. Thank you the organizing team for the opportunity to speak about the topic fitness in diabetes. It's very important for all of us to understand important fact that we are physiotherapists, and one of the most important components to be understood in the field of physiotherapy is our own health, our own fitness levels. And on the funnier aspect, to start off with, I often mention when we are having our offline classes, we often mention that any patient, any client, whoever comes to us, first of all, creates an impression seeing us. And that's very important for all of us to understand. And that's why it is very, very important for all physiotherapists to, first of all, have healthcare as a premier component of their, whether it is a syllabus or whether it is your own personal health or personal care. It's very important for point to be understood, and that's what I'm trying to highlight in the beginning of the session. Let's listen to the holistic side of the healthcare component. For example, if at all I were to give a gift to sir, and that gift would have been a beautiful iPhone 12 Pro, and I would have given that gift to you, and I would have expected, since I'm gifting you a phone, I would have expected that you will communicate to me regularly. But of late, for the last 6 months, I don't get any communication from you. So I'll be definitely worried about it. That what happened to sir? Why is he not communicating with me? And maybe after 6 months or so, I decide to visit you again. And when I visit you, I see that the phone screen is cracked up, and there's probably some curry on the screen of the phone. The phone is being used as a paperweight, and henceforth and so on. So just imagine what will be my feeling when I'm seeing this happen. Will you think that ever I will think about gifting you another gift in future? Answer obviously will be no. I'll never imagine to gift you another gift at all. Just for a second place, in place of me, to the Almighty whom you pray. And in place of you, in place of the iPhone 12 Pro, place your body. Just think that if God has given you this beautiful body and you don't learn how to take care of it, do you deserve anything good beyond that? That's very, very important thing to understand. We are planning so many things. We are planning artistry, we are planning exercise regimes, we are planning about techniques, but we have to understand one most premier thing, and that is whether you actually taken care of things which you have been gifted with. And if you have not taken care of those things which you have been gifted with, you do not deserve anything further. And that's the point which we are trying to highlight with. Apart from this, it's very important for all of us and all physiotherapists to understand that our profession is a clinical profession. It's not only a job-based profession. Clinical profession in the sense, it depends upon something that is based on clinics and your artistry. And that's where fitness for a physiotherapist comes into play. When we talk about fitness for diabetes, there's a question, as a beautiful topic just finished a few minutes before, Dr. Jasmine was explaining about Pilates. The unfortunate component of Indian fitness scenario is there are hardly any physiotherapists in there. Indian Academy of Fitness Training takes the pride to be the first institute in the entire country which launched a fitness program exclusively for the physiotherapists and to be taught to the physiotherapists. The reason why I insist upon speaking about this particular point in the beginning is when you are training fitness into the fitness industry, you will be competing with many other artists, those who will be dance teachers, those who will be yoga teachers, those who will be exercise instructors. What is so special about you? Why should a physiotherapist be over there? And why is it important for a physiotherapist to learn about fitness? Let's start with that point and then move into why adaptive fitness. The idea is very simple. Well, if my mother is having diabetes and the doctor has prescribed or the physiotherapist has prescribed him or her get some exercises done. Will I be comfortable sending my mother to a person who is uncertified and unqualified, who is just a six-pack and a zero-figure personality? Ask yourself this question. You will get the answer that I would have been more happier sending my mother or my father to a person who is well qualified and certified, and that's where physiotherapist's importance comes into play. Let's keep aside all the points together. It's very important to understand that yours is a profession which can create jobs, and it is not dependent upon jobs only. And that's why it has to be understood right at the beginning. As it is told in Hindi, नौकरी आखिर किसी का नौकर ही बनाती है, फिजियोथेरेपी मालिक बनाती है। और ये मालिक अगर आपको बनना है तो आपको अपने सेंटर्स रन करने की क्षमता होनी चाहिए। You should learn how to run your own centers, how to develop your own centers, and when you develop your own center, the biggest priority that comes into play is economy. When you buy a center, when you rent a center, you are renting it for 24/7. Are you doing physiotherapy 24/7? Ask yourself this question. That's a very important vital question, because that's where our budding physiotherapist gets into problem, starting off their clinics, starting off their centers, not getting enough finances and struggling to begin with. And that's where fitness comes into play. When you have a 9 to 5 dose or a time of duty of physiotherapy and you're seeing good number of physiotherapy patients, do you do physiotherapy also from 6 to 8 or 6 to 9 early in the morning, or maybe 6 to 9 in the evening? Are you doing that? If you're not doing it and you have rented a place or bought a place, you're misutilizing the space. That's where you need to understand fitness plays an important role. If you have an early morning batch of fitness, a midday batch of fitness, and a post office hour batch of fitness, that can be a fantastic addendum to the financial requirements of your clinic. That's so important for all of us to understand. Apart from this, it's very important thing to understand that physiotherapists, after getting 6.5 years of qualification, it's very surprising that when it comes to teaching exercises, it's a cine artist or a sportsman or a Babaji who is teaching exercises. That's unfortunate, because we never thought it to be a part of our profession. And that's where we have to understand that the physiotherapist is not meant to get a zero-figure body or a six-pack body. It is about getting deeper into the fitness industry. And getting deeper means getting into the clinical aspects of fitness industry, which the other part of the fitness industry cannot even think about. You have to decide which exercises, how much exercises, what type of exercises, and that's where the importance of physiotherapist comes into play, and that's where clinical fitness topics like diabetic fitness comes into play. Indian Academy of Fitness Training has been highlighting this topic and many other such topics about clinical fitness from almost 7 to 8 years now, seeing successful students practicing in different cities of the country, earning well, doing well with their patients, and that's what is more credible for all of us. Now let's get into the topic of diabetic fitness. Many of us understand and know that one of the most premier problems of our country is diabetes, and India is being named as the capital of diabetes. To be very lighter on this particular topic, we have to understand that diabetes is also sometimes called as the rich man's disease. Rich man's disease means people those who have a lot of finances, less of physical activity, are more prone to this. Yes, to some extent true, but not in all extent if we understand diabetes properly. Type 1 and type 2, two major types of diabetes. Type 1 is insulin dependent, and type 2 is the insulin independent type of diabetes. When we are talking about the insulin dependent one, that means that your islet cells Langerhans is secreting enough amount of insulin, but I'm sorry, it's secreting insulin, but that's not enough in quantity. So if you have external insulin coming into your body, it responds and you have a better health. The second type of diabetes, which is insulin independent, even if you give insulin, your cells are not responding to it because they have lost the reception quality to insulin of your body. And that's where, again, very importantly, exercise comes into play. Both the type of diabetes have different types of exercise interventions, and we need to be very clear about what kind of exercise intervention we need to do in each type and what kind of medication we need to use for each one of them. When we are discussing about this particular point, let's first highlight certain important point. What does exercise do? What type of exercise do we need to do? And what are the international guidelines for that? There are two major bodies which are going to give you the guidelines of exercise in diabetes. One is American Diabetic Association or ADA and American College of Sports Medicine. Today we will be discussing about the major guidelines of these two institutes. And for this particular thing, we need to highlight a very important and lighter aspect. If you judge anybody who has got a diabetic person in the family, ask yourself this question whether they are exercising. Many of them will not be adequately exercising. Moreover, if at all they are exercising, it's very important what kind of exercise they are doing. Maybe a walk, maybe some shoulder exercises, maybe little pranayama, and that's all. Now let's reveal you a big breaking news. And the breaking news is the ADA guideline states the most important exercise for a diabetic person is not only aerobics, not only breathing, not only mobilization, rather most important exercise is developing new muscles or strengthen muscles. That's very important thing to understand. When I use the word new muscle, that doesn't mean that I'm asking you to do a hyperplasia or something like that. It's to develop what you have. Hypertrophy, what you have. Let me make it very simple to understand. If you have three fat guys, three strong big guys in one room, and in the other room you have three small children, and probably you drop into the same room, and in the center of the room you place a platter of samosas. Whom do you expect to finish up the samosas much more quickly? The strongly built boys, or the thin and small boys, those who are hardly probably able to understand and move around? Which children do you think will be able to eat more? The answer is very obvious. The strongly built people will eat more, they will finish up very quickly, and that's where the ADA guidelines comes into play. You have to understand our big boys are quadriceps, hamstring, gluteus maximus, abdominal muscles, back extensors, not extensor digitorum brevis, not lumbricals, not introsacral. I hope I make some sense. I mean to say, it's all the big muscles which are there located in the lower limb, which are going to eat the maximum amount of calories when it comes to eating up sugar or utilizing sugar from the blood. It's very important for all of us to understand that if we do not work these big boys to their maximum capacity available, you are not going to reduce the good amount of blood sugar levels. That's very important for all of us to understand. And that's where we have to understand a bifurcated point. When these big muscles are working, the quadriceps, the hamstring, the glutes, there are various methods by which they can be worked out with, but one of them is strength training, which will also depend upon anaerobic metabolism. Anaerobic metabolism in turn will be depending upon glycogen, and glycogen will be well stored in the muscles and in the liver. When this glycogen is utilized by the muscles, automatically there is a dearth of glycogen. And to fill up this glycogen, it is the glucose is converted and set up glycogen into these tissues. And this glucose needs to be picked up from the blood sugar. Immediate energy comes from the glucose, and anaerobic metabolism energy also comes from the glucose. So you have two sections of pulling it out from the blood sugar level. How do I plan it? It should be planned exactly according to the half-life period of the medication which you're taking. Every diabetic medication which you're taking has got a half-life period. That's where the time when your medication's powers are peaking up. That's the time when you should be coordinating plus or minus 1 hour your exercise regime. And if you do that, you have maximal benefit. Before we start off understanding the exercises in brief, we need to understand that there are certain major contraindications which you should be very, very careful with while you're starting with your exercising with a diabetic patient. One such contraindication is diabetic retinopathy, which can be really a dangerous factor. And that's why, if any client, a simple test can be performed before starting off. Ask them to do a forward bending posture. If they have a blacking out phenomena in front of their eyes, that can be a sign of diabetic retinopathy. Please do refer them back to their diabetologist or physician to get a clearance. That will keep you always very, very safe. Second, I always keep on the funnier aspect that the diabetic fitness instructor needs to be very, very cozy and closely talking to the clients. Reason? Because you need to smell their breath. If they have a fruity breath, it can be a sign of ketoacidosis. And ketoacidosis is a sign of already a metabolic distress. So never exercise such a person immediately without clearance. That's very, very important. Now, apart from all these two major contraindications which you need to take care of, there are a major list of it which you can always go through in your curriculum. We are here not to talk about those particular points, we are here to discuss about the exercises. Now, when we are talking about exercises, another point that comes to my mind is what are the predilection or aggravating factors for diabetes? Amongst the major aggravating factors in diabetes, one such factor is your race. And to be on a sad side, let me reveal it that most of us, those who are am I audible now?
Yes, sir.
Yeah. So most of us, those who are exercising, are aware of this particular fact that strength training has a fantastic capacity of producing a substance called as GLUT4. Now this GLUT4 is a special substance. Why is it a special substance? When we are secreting GLUT4 from our muscles, that too big muscles, this GLUT4 has a tendency to simulate or to be like insulin in nature. And that's where the factor comes into play. When you do not have your cells responding to insulin, you have the GLUT4 doing the role of the insulin, that is easing it out for the sugar molecules to enter your cells. And the surprising component of it is that GLUT4 can be secreted only and only through strength training. This is the most easiest possibility. But the problem is how can a diabetic person be given strength training? And that's where the role of physiotherapist comes into play in major. We have to understand that a diabetic person might have massive musculoskeletal problems as well as associated metabolic disorders like obesity, cardiovascular problems. How am I going to plan an exercise regime which is usually involving cardiovascular exercises also as well as strength training? Guideline states us 3 days of cardiovascular exercises and at least 2 days of strength training a week. That is a total of 5 days per week. Now, cardiovascular exercises, of course, will involve a lot of aerobic that can be definitely be provided with brisk walking, swimming, aerobic dancing, various formats of aerobic methods, cycling. All these things can provide a lot of good quality aerobics. But the question comes up, how do I stimulate my islet cells of Langerhans? How do I utilize the insulin which is already being produced or make myself more receptive to the insulin? Two things. How can I utilize what I am already producing? How can I produce more? And the last point, if my receptors are not functioning well, then how am I going to utilize the glucose? Let's answer this. Type 1 diabetes responds well to those kind of exercises which have a compressive force on the abdominal area and relaxation after that. I'll repeat again. Type 1, remember, where you were secreting insulin, but that was not enough for your body. You need exercises which can stimulate squeezing and bring in circulation to the islet cells of Langerhans so that they can function better and secrete a little bit more of insulin. That is done through the compressive forms of exercises, compressive and relaxation forms of exercises. Whereas the type 2 diabetes, which requires GLUT4 to be secreted into the body, and that requires stimulation of the big muscles. And this stimulation of the big muscles is possible by involving good quality strength training programs, which is tailor-made for their joint requirements. And that is what we are going to see over here for the next 15 to 20 minutes now. Now, the first few exercises which are considered to be the most effective one is few yoga asanas, which we would like to highlight with. One such yoga asana is Yoga Mudra Asana and Manduka Asana. Let's start with a Manduka Asana. And part by part, we'll highlight questions on that. For example, if you're having a Manduka Asana, the patient needs to sit in this position and excavate down or suck in his navel. Put the fist across, breathe out, and bend down. Now, this is a fantastic method by which I can produce a good amount of compression around the islet cells of Langerhans and expect some good amount of circulation as soon as I relax it back. But the question that follows is, can a diabetic patient attain this position? That is surprising. Many yoga teachers, many teachers in the field of fitness do give this prescription, but are we aware that many of them will have musculoskeletal problems which will not allow them to come into this position itself? That's where the role of a physiotherapist comes into play. And when a physiotherapist comes into play into this, he understands that the effect of the exercise is by the compression, not by the knee position. So I can delete this position and bring about the compression again. How? Let's see. If at all, my patient is able to sit on a stool, and after sitting on the stool, does the same activity, excavates the tummy, puts the fist across the navel, breathes out, and the same thing again. It's very simple for all of us to understand that by attaining this posture, I am relaxing and keeping my knee in a very relaxed and loosened position, and as well as attaining the pressure on the abdominal area without bending too much. Question might be asked, sir, how is it possible for a diabetic person with an issue in the back to bend so further? Answer is there with the physiotherapist, and I must congratulate all my colleagues over there that your profession is such a fantastic profession which has answer probably to every problem related to the exercises. Keep a pillow on the thigh, make a fist above the pillow and bend down. What happens with that is the pillow applies extra pressure on your hand and henceforth creates a greater pressure on the abdominal area even without bending too much. And that's the answer. If you cannot bend your back too much, use a pillow on the thigh or on the lap to get a better effect. And that's where a physiotherapist intelligence comes into play. Let's understand another very important point that needs to be highlighted with. A surprising reality of a diabetic person is food, and also, as I mentioned, the strength training component. The strength training component involves big muscles, as I said, and the big muscles will involve a lot of squatting because there is hamstring quadriceps, the gluteus maximus. Now, original squat would have been this. But the question again comes up there, that will my friend with the diabetes or my parent with the diabetes be able to do this squatting, or will it be genuine enough on my part to ask for this squatting? May not be. So what do I do? Very simple. Let's see. Instead of doing a squat, let's change into a functional activity. Make him sit down into a sumo squat position, and from this sumo squat position, just let him lift up and sit to the side. Lift up and sit to the other side. What do I bring about in doing this? He is simulating alternate lunge. This was an alternate lunge, which probably he wouldn't have done that. So the alternative method of doing it is to use a plinth wherein they are lifting up and shifting to one side and lifting up and shifting back to the other side. Such a simple art of tricking out the muscles into doing activities which are safe and hygienic, yet utilizing a lot of big muscles. Now, if my person or my friend wanted to utilize this art for even the upper body as well, what do I need to do for that? Add up an overhead press along with this basic shifting and come back. Use a dumbbell in your hands if you want to make it more powerful. But if you don't want, you can simply use a set of water bottle. Even a half kg water bottle will be useful for that to start off with. But remember, according to the ANA guidelines, it is important for all of us to increase gradually the amount of weight rather than increasing the number of sets or increasing the number of days of exercising. This is something that we need to understand. Now, apart from this, now we have understood how we are going to manipulate this strength training activity. Similarly, if my client had early signs of involvement of the shoulder, which is such a common problem in a diabetic patient, what do I do? Another very important point that becomes a major problem for a diabetic patient is peripheral vasculature. Can I do something as a physical therapist for the peripheral vasculature? Yes, answer is definitely you can do. What can be done? Simple activity. When you have the fingertips, note it carefully, keep pressing the fingertips. It's very simple to understand. Keep pressing the fingertips, different positions. Same with the toes also. What do I do? When you press this, there is sudden change in the coloration. Release it. Again, a sudden change in the coloration. Why do you think it is happening? That's because your peripheral vasculature is intact. Repeating this activity time and again with a diabetic person in whom these color changes will be much more slower, but it will make sure that his peripheral vasculature remains intact. That's very, very important thing for all of us to understand. Because if vasculature is intact, sensation can be kept intact. Problems like diabetic neuropathy can be kept or warded off if we have good circulation coming to the periphery, and that can be done with such a simple activity. Another such activity which can help you in keeping up the peripheral circulation is peripheral massage, which can be simple brushing off or an effleurage. Very simple things, which can be done on the toes, which can be done on the hands to keep on the circulation intact. Some such very important exercises, which will be very useful for the diabetic patient, will be highlighted now. For example, another very important thing that needs to be highlighted for a diabetic patient. Another such important activity which needs to be highlighted when we are talking about exercising in diabetes is vision and diet, which is very important for all of us to understand. The moment anybody is diagnosed with diabetes, we are forced to tell why to rise We are supposed to tell buy or bid adieu to potatoes. We have to understand a very important factor that diabetes is not a curse. Diabetes is a lifestyle disorder, and that's where we have to understand intelligent planning of exercises and food can create a fantastic life and a good chance for the diabetic patient as well. Now, if you are listening carefully and if you are a diabetic patient yourself, here I'm going to reveal a breaking news for all of you that yes, you can have good amount of rice, good amount of fruits, and good amount of potatoes also, but with a little bit of intelligent planning. And that planning is about understanding about the glycemic index. There is something called as the glycemic index and something called as the glycemic load. Glycemic index means the amount of sugar that can be released at a given period of time. How quickly can you release sugar into the blood? That is called as glycemic index. Whereas glycemic load is the total amount of sugar that can be released into your body from a particular food. Any food which has a higher glycemic index, I repeat again, any food that is a higher glycemic index will release sugar very quickly into your body and will be dangerous for a diabetic person. Rice is one such substances which is starchy, which is easy to release sugar, and that's why can be dangerous for a diabetic person. But hold on. Now we have something for all you rice lover and me rice lover as well. And that is how do you manipulate the glycemic index? If you have attended any yajna done, you must have heard of whenever you are offering any rice to the yajna, it is called as paramanna. And why? What do you mean by paramanna? Few days back, I had a chance of attending an yajna, and I forced myself to ask this question to the Panditji who was doing the yajna. And Parama Anna, I came to know, is Anna, that is rice mixed with ghee. And that's the breaking news, my dear friends. A person who is diabetic needs to understand that if something is there which is very high on glycemic index, and that is added to something which is very low on glycemic index, the mixture comes into a moderately low glycemic index substance. For example, if you want to eat rice, add ghee to it, or because ghee is rich in fat and good quality fat, that's where it will lower the glycemic index. Whereas other things that can be added to the rice is rajma, chole, anything that is rich in protein. Maybe a non-vegetarian friend of mine would like to take a little bit of chicken, that can also be taken, but it should be lower on glycemic index. If it is added to the rice, you can very well have some. Here you have to understand that many of the fruits do not require insulin to get ingested because fructose based substances may not require that much amount of insulin as many other food. And that's why lots of fruits, specifically the citric acid fruits, can be very easily taken by a diabetic person as well. So now you have to understand a big reality. Diabetic person need not live a curseful life. Rather than that, he needs to lead a disciplined and intelligent life. With that, he comes to a level where he can eat small amounts of almost everything, small amounts of all substances, but in a regulated and a disciplined pattern. And that's why it is very important for all of us to understand, do not just simply block a certain amount of food for a diabetic person. Here's another very important point that is going to come out and with the next point of discussion. A diabetic person, I have seen that happening with most of my patients, have a predilection or a greater chance of getting cataract. Now, this is a massive problem, and that's where we have to again have a breaking news. And this breaking news is that cataract can be again prevented with good quality circulation to the eye, as well as retina, which is a component of the eye, as well as good quality food. Let's first target the exercise component. We understand that there are a few muscles in the eyes: lateral rectus, medial rectus, superior rectus, inferior rectus, obliques. All these muscles are present in the eyes, but are we exercising them? Test yourself today. Anybody who is now moving his eyes all around and the corner of their eyes, if they are having a pain, my dear friend, you are already in problem. Specifically, those friends of mine, those who are using spectacles and are getting that particular pain on each side of the angle. My dear friends, you're already in problem. It's high time to start exercising for your eyes, because that's a precious gift. All the profession which you are running around and we are running around with depends upon this beautiful set of eyes. So please do take care of that. What do I eat with that? It's very important to understand one special amino acid called phenylalanine, which is also very importantly present in milk and milk products. Here, a question that might come into our mind is again whether the diabetics are allowed to drink enough amount of milk or not. Yes, you are. As long as the milk which you are drinking is based on A2 proteins. Yes, you are allowed to drink. That is based out of Indian cows and Indian breeds. So please do make sure that you are exercising the abdominal area, you're exercising the big muscles, you're exercising the eyes. These are very important components. You're exercising the periphery and you are mixing your food well. That makes a good diabetic fitness training session. And that's where I understand we're coming close to the end of the session. And I would like to request, sir, that if there are any questions that needs to be asked in the field of diabetes, they can put up the questions now.
Thank you very much, sir, for such an interesting lecture and practical demonstration of the various asanas on fitness in diabetes. Sir, there are some questions. One gentleman asked any particular exercise that you would recommend for a geriatric diabetic patient with a history of stroke, since the vasculature comes into the picture. So this is the question has been asked, sir.
Yes, a good question, a very good question. Now, when a person is suffering from a stroke, we need to understand, because this is a wide question that has been asked. Before getting into specification of what exercise can be given, this answer I would start with a question again. We need to judge their functional capacities. Because once we know what functional capacities this person is already harboring with that functional capacity, try and utilize the big muscles, whatever is possible. And that's the trick of a physiotherapist to manage a diabetic person who is also having a stroke. Am I clear about the answer, sir?
Yes, sir. So there is one more question. In diabetic patient who has a BP and gout, what diet can be given, and also when the patient is obese, what all are the easy exercise that can be given to them which can help in reducing the weight also?
Good question again. Very good question, because all the time I have been speaking about giving you strength training, giving you exercises which can build up the muscles, but this is a very big complication of strength training. If not coordinated well, strength training can lead to increase in blood pressure. And that's where a big problem of exercise comes into play, and that's why unqualified people can create a havoc for a diabetic person. And that's where a physiotherapist is a great boon and a mercy to the society. Understand that if we are performing Valsalva with our exercise, Valsalva, that means this is one of the major cause of shooting up the blood pressure. Whereas a physiotherapist instructor, what he will do is exercise with breath coordination. When we are having this particular activity, that's where diabetes will respond very nicely to exercising, even to good quality strength training. And as previously Dr. Jasmine was highlighting, Pilates exercises. I really love to perform Pilates, and that's where I understand that this is one such exercise which all of your diabetes patient can do, because one of the major criteria of Pilates is proper breath coordination. You cannot hold breath while doing Pilates. And that's where these can also be given to diabetic patients.
Thank you, sir. Sir, I have one question, sir.
Yes.
Since we are working in the Department of Neurophysiotherapy, and
Yes.
we get a very young onset of patient with drug-induced diabetes. The patient
Yes.
are with a history of autoimmune disorders with a vasculitis neuropathy, and
Yes.
along with that, patients are like almost quadriplegic. They are not able to stand and not able to get up by themselves. So
Hmm.
to control the diabetes in such patients, is there any specific asana or anything can be, any exercise can be given to such patients?
Very good question. Very, very good question. And I probably, if they're offline, then I would have given you a tight hug for this question.
Thank you,
And
sir.
understanding of this is when nothing works, diaphragmatic breathing is the biggest pump for getting the circulation into the visceral organs functioning. And that's what the diabetic neuropathy patient and all these patients, those who do not have major amount of functional capacities, can do a great world of change for them. Just hold on to good quality abdominal expansion and relaxation. Keep on this particular pump, because remember, whether pregnancy, whether diabetic, diaphragmatic breathing is a functional exercise. I repeat again, diaphragmatic breathing is a functional exercise. जब प्राणायाम नहीं हो पाता, तब diaphragmatic breathing उसके जगह में काम कर जाता है.
Thank you, sir. Thank you very much. And I'll be asking the last question, sir.
Yes. Yes.
Is there any specific exercise for a patient with diabetic and varicose veins can be prescribed?
Yes. Again, a very good question. Now, the varicose veins needs to be highlighted whether it is the deep veins which is involved or if it is only the superficial veins which is involved. Understandably, if there is no pain, it is the superficial veins which is getting involved only. I would suggest only do some amount of drainage exercises, that is massage, and lift it up against gravity and relax it out after exercising. That will be doing the trick of it. But if there is pain associated to it, you need a surgical intervention probably, or a guidance from a surgeon to get involved into this, because there might be a metabolic distress undergoing. So I would always suggest that if it is a superficial vein which is in problem, massage, light exercises, elevated positions, that will do the trick. But if it is a deep vein which is in problem, signified with lot of pain existing along the varicose veins, let's not take chances. Let's take an intervention from an invasive therapist or an invasive surgeon.
Thank you, sir. Thank you very much. And we're very glad to have you on the today's lecture on diabetes fitness. I'm very thankful to you and very much thank you for the presentation. So thank you very much.
Thank you, sir.